When most people hear the word depression, they think of sadness. But depression isn't just feeling sad. It can make you sleep too much or not at all. It can leave you exhausted, even after hours of rest. It can appear after childbirth, during certain seasons, after a traumatic event, or even because of medication or substance use. In fact, there isn't just one type of depression. There are many, and understanding the differences could help you better understand yourself or someone you care about. In the next 20 minutes, we'll explore the most common types of depression, how they affect the brain, and the signs you shouldn't ignore. Welcome to Inside Your Mind. Before we begin, subscribe to Inside Your Mind for simple, evidence-based videos about psychology, mental health, and human behavior. And if you've ever wondered why your mind works the way it does, you're in the right place. This video is for educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Depression isn't simply a bad day, a rough week, or feeling unmotivated. The most recognized form of depression is called Major Depressive Disorder, often shortened to MDD. This condition affects millions of people worldwide and can significantly impact how someone thinks, feels, and functions in everyday life. To receive a clinical diagnosis, symptoms usually need to last for at least 2 weeks and represent a noticeable change from a person's normal behavior. People with major depressive disorder often experience a persistent feeling of sadness, emptiness, or hopelessness. But emotional pain is only one part of the picture. Depression can also cause physical symptoms, including fatigue, sleep problems, changes in appetite, difficulty concentrating, and a loss of interest in activities that once brought joy. Even simple tasks, like getting out of bed, answering messages, or taking a shower, can start to feel overwhelming. Many people describe it as carrying an invisible weight that follows them everywhere. Scientists believe major depressive disorder is linked to a combination of factors, including genetics, stressful life events, brain chemistry, trauma, and chronic stress. Brain imaging studies have shown changes in areas involved in mood regulation, memory, motivation, and decision-making. It's important to remember that depression is not a sign of weakness, laziness, or a lack of willpower. It is a real medical condition that affects both the mind and the body. The good news is that treatment can help. Therapy, lifestyle changes, social support, and medication can make a significant difference for many people. And the sooner someone seeks help, the better the chances of recovery. While major depressive disorder often comes in episodes, some people experience depression differently. Instead of intense symptoms that appear suddenly, they live with a low mood that never seems to fully go away. This condition is called Persistent Depressive Disorder, or PDD, previously known as dysthymia. People with PDD may feel depressed most of the day, more days than not, for at least 2 years. Because the symptoms last so long, many people begin to believe that feeling this way is simply part of their personality. They might say things like, "I've always been like this. I'm just a negative person. This is normal for me." But persistent sadness, low energy, and a constant lack of motivation are not personality traits. They can be signs of a treatable mental health condition. Symptoms of PDD are often less severe than those of major depressive disorder, but they tend to last much longer. Common symptoms include low self-esteem, difficulty concentrating, changes in sleep patterns, fatigue, hopelessness, and a reduced ability to enjoy life. Imagine carrying a heavy backpack every single day. You may learn to function with that weight, but it still affects every step you take. That's what persistent depressive disorder can feel like. Some people with PDD also experience episodes of major depressive disorder, a condition sometimes called double depression. Because the symptoms develop gradually, this disorder often goes undiagnosed for years. The good news is that long-term depression is treatable. Therapy, Medication, healthy routines, regular exercise, and strong social support can help people regain energy, hope, and a sense of enjoyment in life. Feeling emotionally exhausted all the time should never be accepted as your normal. Have you ever noticed your mood changing with the seasons? Maybe you feel more tired, less motivated, or emotionally drained during the colder months. For some people, these changes go far beyond the typical winter blues. This condition is known as Seasonal Affective Disorder, or SID. Seasonal affective disorder is a type of depression that follows a recurring seasonal pattern, most commonly appearing during the fall and winter months and improving when spring arrives. Experts believe the reduced exposure to sunlight can disrupt the body's internal clock, also known as the circadian rhythm. Lower levels of sunlight may also affect important brain chemicals like serotonin, which helps regulate mood, and melatonin, which influences sleep. As a result, people with SAD may feel unusually tired, sleepy, and emotionally withdrawn. Common symptoms include low energy, oversleeping, difficulty concentrating, increased appetite, weight gain, social withdrawal, and a persistent feeling of sadness or hopelessness. Activities that once felt enjoyable can begin to feel exhausting. Even getting out of bed may seem like a challenge. Although winter pattern SID is the most common form, some people experience symptoms during the spring or summer months instead. Seasonal depression is more than simply disliking cold weather. It is a real mental health condition that can interfere with work, relationships, and overall quality of life. The good news is that effective treatments are available. Light therapy, psychotherapy, regular exercise, maintaining a consistent sleep schedule, and spending time outdoors can significantly reduce symptoms. Understanding the connection between mood and seasonal changes can help people recognize when it's time to seek support. Bringing a new baby into the world is often described as one of life's happiest moments. But for many new parents, the experience can also bring unexpected feelings of sadness, anxiety, exhaustion, and emotional disconnection. While it's normal to experience mood swings and emotional sensitivity after childbirth, often called the baby blues, these feelings usually improve within a couple of weeks. When symptoms become more intense, last longer, and begin interfering with daily life, it may be a sign of postpartum depression. Postpartum depression is a serious mental health condition that can develop during pregnancy or within the first year after giving birth. It affects millions of parents worldwide and is caused by a complex combination of physical, emotional, and social factors. After childbirth, hormone levels change rapidly. At the same time, new parents often experience sleep deprivation, physical recovery, changes in identity, financial stress, and the pressure of caring for a newborn. Together, these challenges can significantly impact mental health. Common symptoms include persistent sadness, intense irritability, feelings of guilt or worthlessness, frequent crying, difficulty bonding with the baby, loss of interest in daily activities, changes in appetite, and overwhelming fatigue. Some people may also experience intrusive thoughts or fears about their ability to care for their child. Postpartum depression is not a sign of weakness, failure, or being a bad parent. It is a medical condition. And like other forms of depression, it is treatable. Therapy, support groups, medication, adequate rest, and practical help from family and friends can make a meaningful difference. Seeking help is not selfish. Taking care of your mental health is one of the most important ways to care for both yourself and your child. When people think about bipolar disorder, they often focus on the periods of extreme energy and elevated mood, known as mania. But what many people don't realize is that individuals with bipolar disorder often spend much more time experiencing depression than mania. This is called bipolar depression. Bipolar disorder is a mental health condition characterized by significant shifts in mood, energy levels, activity, and behavior. These shifts typically occur between depressive episodes and periods of mania or hypomania. During depressive episodes, symptoms can look very similar to major depressive disorder. People may experience intense sadness, hopelessness, fatigue, difficulty concentrating, changes in sleep and appetite, and a loss of interest in activities they once enjoyed. Even simple daily tasks can feel impossible. The key difference is that these depressive episodes are part of a larger pattern of mood changes. During manic episodes, a person may feel unusually energetic, euphoric, restless, or overly confident. They might sleep very little, talk faster than usual, take impulsive risks, or feel like their thoughts are racing. In hypomania, these symptoms are milder, but still represent a noticeable change in behavior. Because depressive episodes are often the most visible symptoms, bipolar disorder is sometimes misdiagnosed as major depressive disorder. This is why understanding a person's full mental health history is so important. Treating bipolar depression usually involves a combination of medication, psychotherapy, healthy routines, stress management, and strong social support. Proper diagnosis matters because some treatments used for major depressive disorder may not be appropriate for bipolar disorder on their own. If you recognize cycles of extreme highs and lows in yourself or someone you know, speaking with a qualified mental health professional can be an important first step. Bipolar disorder can be challenging, but with the right treatment and support, many people lead stable, meaningful, and fulfilling lives. Despite its name, atypical depression is not rare or unusual. In fact, it's one of the most common subtypes of depression. The term atypical simply means that its symptoms don't always match what people traditionally associate with depression. When most people think of depression, they imagine someone who feels sad all the time and struggles to experience joy. But people with atypical depression can temporarily feel better when positive things happen. A good conversation, exciting news, or spending time with loved ones may briefly improve their mood. This ability to react positively to pleasant events is called mood reactivity, and it's one of the key features of this condition. However, those moments of relief are usually short-lived. The underlying symptoms often return quickly and continue to interfere with daily life. Common symptoms of atypical depression include sleeping too much, increased appetite, weight gain, low energy, difficulty concentrating, and a heavy feeling in the arms and legs, sometimes described as moving through wet cement. Many people also experience intense sensitivity to criticism, rejection, or perceived disapproval from others. This emotional sensitivity can affect relationships, work, and self-esteem. Because people with atypical depression may smile, socialize, or seem fine at certain moments, others often underestimate what they're going through. But experiencing temporary moments of happiness does not mean someone isn't struggling with depression. Atypical depression is a real and treatable mental health condition. Treatment may include psychotherapy, medication, regular exercise, healthy sleep habits, and strong social support. Understanding that depression can look different from person to person is an important step toward reducing stigma and encouraging people to seek help. Sometimes, depression develops after a major life event, the loss of a loved one, the end of a relationship, financial problems, losing a job, moving to a new city, or experiencing a serious illness can all have a profound impact on mental health. When depressive symptoms are triggered by a specific stressful event or life change, it may be referred to as situational depression. Clinically, mental health professionals often describe this condition as an adjustment disorder with depressed mood. Unlike some other types of depression, situational depression usually has a clear starting point. People can often identify exactly when their emotional struggles began. However, that doesn't make the pain any less real. Common symptoms include persistent sadness, crying spells, low energy, difficulty concentrating, changes in sleep patterns, loss of motivation, feelings of hopelessness, and withdrawing from friends and family. Many people feel overwhelmed by emotions they weren't prepared to handle. Tasks that once seemed simple can suddenly feel impossible. It's important to understand that struggling after a major life event is not a sign of weakness. Human beings are deeply affected by change, loss, uncertainty, and stress. For some people, these emotional reactions gradually improve as they adapt to their new circumstances. For others, the symptoms may persist or become more severe over time. That's why paying attention to how long symptoms last and how much they interfere with daily life is so important. Therapy, social support, stress management techniques, healthy routines, and self-compassion can all play an important role in recovery. Healing doesn't mean forgetting what happened. It means learning how to move forward while carrying your experiences in a healthier way. And sometimes, asking for help is the strongest step you can take. Many people experience physical and emotional changes before their menstrual period. Mild mood swings, irritability, or fatigue are common symptoms of premenstrual syndrome, also known as PMS. But for some individuals, these symptoms become so intense that they significantly disrupt daily life. This condition is called Premenstrual Dysphoric Disorder, or PMDD. PMDD is a severe form of premenstrual mood disorder that affects a smaller percentage of people who menstruate. Unlike PMS, PMDD can cause intense emotional and psychological symptoms that interfere with work, relationships, and overall well-being. Symptoms usually appear during the week or two before menstruation and often improve shortly after the period begins. Common symptoms include severe mood swings, irritability, anxiety, sadness, feelings of hopelessness, difficulty concentrating, changes in sleep, fatigue, and a loss of interest in daily activities. Some people may also experience physical symptoms such as bloating, headaches, breast tenderness, or changes in appetite. Researchers believe PMDD is not caused by abnormal hormone levels themselves. Instead, it appears to involve an increased sensitivity to the natural hormonal changes that occur during the menstrual cycle. These hormonal fluctuations can affect important brain chemicals, including serotonin, which plays a key role in regulating mood. Because PMDD symptoms occur on a predictable cycle, tracking emotional and physical changes over several months can help identify patterns. Unfortunately, many people dismiss their symptoms or feel misunderstood by others. But PMDD is a real medical condition, not an overreaction or a sign of weakness. Effective treatments are available. Therapy, lifestyle changes, stress management techniques, certain medications, and hormonal treatments can help reduce symptoms and improve quality of life. Understanding the connection between hormones and mental health is an important step toward getting the support you deserve. Sometimes, depressive symptoms are not caused solely by life circumstances or underlying mental health conditions. In some cases, they may be linked to the use of certain substances or medications. This condition is known as Substance-Induced Depression. Alcohol, recreational drugs, prescription medications, and even withdrawal from certain substances can affect the brain's chemistry and influence mood. Because these substances interact with important neurotransmitters like serotonin, dopamine, and norepinephrine, they can contribute to feelings of sadness, hopelessness, fatigue, and emotional numbness. Alcohol is a common example. Although it may temporarily create feelings of relaxation or relief, alcohol is actually a depressant, meaning it can worsen mood over time. Other substances, including stimulants, opioids, sedatives, and some medications, may also trigger or intensify depressive symptoms. In some cases, symptoms begin while using the substance. In others, they appear during withdrawal, when the brain is adjusting to functioning without it. Common symptoms include persistent sadness, low motivation, irritability, sleep disturbances, difficulty concentrating, and a loss of interest in activities that once felt enjoyable. Because these symptoms can closely resemble other forms of depression, identifying the connection to substance use is an important part of diagnosis. It's important to understand that experiencing substance-induced depression does not mean someone lacks willpower or has failed in some way. Addiction and substance-related disorders are complex medical conditions that affect both the brain and behavior. Recovery often requires a combination of professional support, therapy, medical supervision, lifestyle changes, and a strong support system. Seeking help early can make a significant difference. Treating both the substance use and the depressive symptoms together often leads to better long-term outcomes. No one should have to face these challenges alone. Depression can sometimes become so severe that it affects the way a person perceives reality. This condition is known as Psychotic Depression, or Major Depressive Disorder with psychotic features. Although it is less common than other forms of depression, it is a serious condition that requires immediate professional attention. People with psychotic depression experience the symptoms of major depressive disorder alongside episodes of psychosis. Psychosis can involve delusions, which are strong beliefs that aren't based in reality, or hallucinations, which involve seeing, hearing, or feeling things that others do not. These experiences are often connected to themes of guilt, worthlessness, illness, failure, or hopelessness. For example, someone might believe they are responsible for terrible events that never happened, feel convinced that they are beyond help, or hear critical voices reinforcing negative thoughts. Because these symptoms can be frightening or confusing, many people hesitate to talk about them. Others may fear judgment or worry that no one will understand what they're experiencing. As a result, psychotic depression often goes unnoticed or is mistaken for another condition. It's important to understand that psychosis is not a sign of weakness or a character flaw. It is a medical symptom that can occur in several mental health conditions, including severe depression. Psychotic depression is treatable, but early intervention is essential. Treatment typically involves a combination of medication, psychotherapy, and close medical supervision. In some cases, hospitalization may be necessary to ensure safety and provide intensive support. If someone is experiencing hallucinations, delusions, thoughts of self-harm, or is struggling to distinguish reality from their thoughts, seeking immediate professional help is critical. Recovery is possible, and no one should face these symptoms alone. Sometimes, depression develops after a person experiences or witnesses a traumatic event. Events such as abuse, violence, serious accidents, natural disasters, combat, or the sudden loss of a loved one can leave lasting emotional wounds. For some people, these experiences may lead to post-traumatic stress disorder, commonly known as PTSD. And for many individuals living with PTSD, depression becomes part of that struggle. PTSD is more than simply remembering something painful. It can change the way the brain responds to stress, danger, and emotions. People with PTSD often experience intrusive memories, nightmares, flashbacks, difficulty sleeping, and a constant sense of being on high alert. Over time, living in a state of fear and emotional exhaustion can increase the risk of developing depression. Someone may begin to lose interest in activities they once enjoyed, withdraw from loved ones, struggle with feelings of guilt or shame, and feel disconnected from the world around them. They may believe that no one understands what they're going through, or that things will never get better. But these feelings are not a sign of weakness. They are common responses to overwhelming experiences. Trauma can affect important areas of the brain involved in memory, emotional regulation, and threat detection. The brain learns to stay in survival mode, even when the danger has passed. Understanding this connection can help reduce self-blame and encourage people to seek support. Recovery is possible. Trauma-focused therapies, support groups, medication, healthy coping strategies, and strong social connections can help people heal over time. Healing from trauma doesn't mean forgetting what happened. It means learning how to move forward without letting the past control your present. If you or someone you know is struggling after a traumatic experience, reaching out for professional help can be an important first step. Depression is not one single experience. It can look different from person to person, and understanding these differences is an important step toward compassion, awareness, and recovery. If you recognized yourself or someone you care about in this video, remember that help is available and healing is possible. If you enjoyed this video, subscribe to Inside Your Mind for more easy-to-understand content about psychology, mental health, and human behavior. And let us know in the comments. What mental health topic would you like us to explore next? Until next time, take care of your mind.